Diabetes is a chronic illness brought on by the body's improper utilization of blood sugar, glucose. Type 1 diabetes is primarily brought on by a lack of insulin. It happens when cells that produce insulin are killed or damaged and stop producing insulin. The body needs insulin to transport blood sugar into all of its cells. Because of the ensuing insulin shortage, there's too much sugar in the blood and insufficient sugar for the cells to use as fuel. Although the precise etiology of this dysfunction is unknown, environmental and genetic factors may contribute. Obesity, genetics, and smoking are all risk factors for diabetes. Insulin resistance can be a result of excess body fat. Inflammation brought on by fatty tissue may result in insulin resistance. On the other hand, a large number of people who are fat do not go on to get diabetes, and additional research is required to identify the nature of the connection between obesity and diabetes. Your genetic makeup has a role in determining how likely it is that you may acquire diabetes of any kind. Researchers do not yet have a complete understanding of the role that genetics play in the development of diabetes. Here in this video, we will talk about the types of people who can get diabetes. The video is going to be very interesting, so make sure you stuck at end. Before we continue to our video, make sure to smash the like button, subscribe to our channel, and hit the bell icon to never miss any of our future uploads. Now let's get started. 1. Obesity. Although the chance does rise with age, obesity is no longer solely a sickness that affects older individuals, as more and more young people are being identified as having the condition. There is an alarmingly high prevalence of childhood obesity in England, with 31.2% of children and adolescents between the ages of 2 and 15 being overweight. There is a correlation between obesity and type 2 diabetes. Despite the fact that the precise causes of diabetes are not yet completely understood, it is known that a number of factors can have an effect on the chance of acquiring various types of diabetes mellitus. Being overweight or obese is included with type 2 diabetes, having a body mass index. While current research indicates that obese persons are up to 80 times more likely to get type 2 diabetes than those with a BMI of less than 22, obesity is really thought to be responsible for 85% of the risk of developing type 2 diabetes. How can type 2 diabetes result from obesity? It is common knowledge that people who are overweight or obese are more likely to develop type 2 diabetes, especially if they have extra weight around their stomach's abdomen. Obesity is a result of inflammation. According to research, abdominal obesity causes fat cells to produce pro-inflammatory chemicals. These chemicals can lower the body's sensitivity to the insulin that it produces by interfering with the ability of insulin-responsive cells to function. Insulin resistance is what causes this and is a defining feature of type 2 diabetes. Another reason is a disruption in the metabolism of fat. It's also believed that obesity alters the body's metabolism. These modifications lead to the release of fat molecules into the circulation from fat tissue, adipose tissue, which can impact insulin-responsive cells and decrease insulin sensitivity. According to a different hypothesis put out by researchers, obesity triggers prediabetes, a metabolic disorder that almost always progresses to type 2 diabetes. How to avoid being obese? The relationship between obesity and type 2 diabetes is well recognized. Without the help of a good diet and regular exercise, obesity can quickly progress to type 2 diabetes. The good news is that losing even a modest amount of weight can help your body become more sensitive to insulin and reduce your chance of developing cardiovascular and metabolic diseases like type 2 diabetes, heart disease, and some types of cancer. 2. Genetics. A significant public health issue is diabetes. The majority of the genetic risk of diabetes for types 1 and 2 remains unsolved, despite significant progress in delineating the genetic risk for particular subtypes of diabetes, such as maturity-onset diabetes of the young. It will be possible to identify people who have diabetes and are at risk, and develop tailored interventional and therapy techniques if genes that affect risk or protection of diabetes and its consequences are discovered. By the time a kid reaches the age of 30 years, type 1 diabetes may affect up to 0.4% of children in some populations, with a lifetime risk of just under 1%. The death of pancreatic cells by the immune system is thought to cause a significant fraction of type 1 diabetes cases, leaving patients completely dependent on exogenous insulin to control their blood glucose levels. With a hereditary risk ratio of roughly 15, type 1 diabetes is strongly concentrated in families. The genetic cause of type 2 diabetes has proven to be challenging to identify. Type 2 diabetes is a condition of relative rather than absolute insulin insufficiency, in contrast to type 1 diabetes, which appears to be an autoimmune process. In type 2 diabetes, the pancreas cells gradually lose their capacity to generate enough insulin to maintain healthy lipid and carbohydrate homeostasis. In addition, there's insulin resistance along with aging, obesity, and decreased exercise effects. Additionally, with an overall genetic risk ratio ranging from 2 to 4, type 2 diabetes appears to have a less genetic component to its causation than type 1 diabetes. Several genome-wide scans have shown a variety of chromosomal areas that may hold genes involved in type 2 diabetes, despite the relatively low hereditary risk ratio for the disease. 3. Smoking. In the United States, cigarette smoking kills more people each year than all forms of AIDS, alcohol, motor vehicle accidents, homicide, suicide, illegal narcotics, and fires combined. 12. You may already be aware that smoking increases a person's risk for developing cancer, as well as heart, lung, and other organ ailments. However, you might be unaware that smoking raises your risk of developing type 2 diabetes. According to the 2014 Surgeon General's report, smoking can increase a person's risk for type 2 diabetes in a number of different ways. 18. The chemicals in cigarettes injure your body cells and can impair their ability to function normally. The body may become inflamed as a result, which could make insulin less efficient. Additionally, a condition known as oxidative stress can be brought on when chemicals from cigarette smoke interact with oxygen in the body. It is possible that oxidative damage and inflammation are linked to an increased risk of developing diabetes. Smokers have a risk of acquiring type 2 diabetes that is 30 to 40% higher than the risk faced by non-smokers. Because nicotine in high quantities can lower insulin's effectiveness, smokers will need to use more insulin to regulate their blood sugar levels if they continue to smoke. This is another way that smoking can make treating the disease and maintaining insulin levels more difficult. Diabetes can cause a number of health issues, including, but not limited to heart disease, blindness, and kidney failure, if it is not properly managed. To protect your health, give up smoking before you get major illnesses like diabetes. But if you smoke and have type 2 diabetes, it's not too late to stop. It might be simpler to control your diabetes if you do this. At any age, quitting smoking is advantageous. It is difficult, but it is feasible. The sooner you stop, whether you have type 2 diabetes or not, the sooner your body can begin to recover. In fact, research has shown that 8 weeks after quitting smoking, insulin starts to work better in lowering blood sugar levels. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. Thanks for watching and have a wonderful day.